Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Michael Archuleta. He's CIO at Mount San Rafael Hospitals and Clinics. Welcome, Michael.
Hey, thank you, John. Really honored to be here. It's definitely been a while, so it's great to see you.
It has been a while. I mean, you're actually a return guest. I think only our second return guest, which is kind of crazy. We probably need to go back a bit more often, but it's great to have you back on the show. But for those that don't know you, tell us a little bit about yourself and Mount San Rafael Hospitals and Clinics.
Absolutely. So again, my name is Mike Archuleta. I'm the CIO at Mount San Rafael here in Southern Colorado. We're really a high-performing healthcare organization and a vital care hub for our overall region, which really focuses on delivering really advanced services and technology that people really often associate with much larger systems. My focus as CIO has always been really simple. It's really to use smart, practical technology to really make care better, safer, and more sustainable for people who really depend on us here in our overall region.
Yeah, that's awesome. Well, I was excited to have you on because you recently decided to change EHRs. Tell me a bit about the process you went through to select a new HR, and then eventually we'll talk about like which one you selected and some of that. But what was that process like to kind of say, "Hey, I need a new EHR," and how did you decide which one to go with?
Yeah, absolutely, John. So we really treated this overall project as a clinical, operational, and a financial decision, not just a technology project. Our previous system really had supported us for a very long time, but it was no longer really aligned to where like healthcare is heading, especially with innovation, with artificial intelligence, just a lot of the complexities around healthcare, and really even focused around, interoperability, usability, and really long-term sustainability, which I think is extremely critical for anything that we do. We formed a cross-functional team that really included a lot of clinical leaders, our revenue cycle team, our operations, and IT. We really wanted to evaluate what the current workflow impact was, what the actual total cost of ownership, what type of vendor support were we looking at having? Because I've always stated this too, is that vendor support is such a critical thing, especially with any group that you choose. I hate using the word vendor because we're always looking for a
Mm,
business partner that states my success is your success and your success is ours. I think that is extremely critical moving forward with selecting a specific top electronic medical record system. One big thing too for myself was the innovation roadmap.
mm.
What type of innovations do they have incorporated into their overall process? We hear the massive boom of artificial intelligence, the massive boom of automation, the massive boom of really moving forward in that digital strategy, which is extremely important. And what we wanted to really determine too was a long-term partnership potential. I think this was really critical moving forward to say who is going to be a strong partner for an organization like ours. We also spoke with peer organizations and we really, reviewed real world experiences and different specific initiatives that were being demonstrated with other facilities. And at the end of the day, we weren't just selecting software, we were choosing a strategic partner again for the next decade of care delivery for our organization itself.
Yeah, that makes sense. I mean, we face that at Healthcare IT Today. It's like if we write about EHR, we get tons of traffic because it is so influential on and impactful on so many people within healthcare. So it makes sense why that decision, needs to be a partner and not just a vendor. What were some of the key things that that led you to choose to go with Oracle Health and of course their new Oracle Health clinical AI agent?
Yeah, absolutely. So, several things really stood out with Oracle Health. So, first, the platform is a connected ecosystem where like clinical, financial, and operational workflows are really unified, and that really reduces friction between departments and really gives us a clearer real-time view of the organization. One issue that we were really trying to kind of determine is within the organization here at Mount San, we had so many multiple systems in place, so many disparate systems, so many legacy specific systems, and we wanted to come into a standpoint where we were able to unify all these specific platforms into one solution. Inpatient, OR, ED, rehab services, different departmental clinical services, ambulatory EHR, everything built into that specific one view was such a critical element
Are
in
you
going
doing
this
ERP as
direction.
well as part of that?
I'm sorry, what was that
Are
again?
you doing ERP as well as part of that,
We
or?
are also doing ERP as well. That is correct. So incorporating some of the financials, incorporating some of the revenue cycle integration capabilities was also a very important aspect for us too. But one of the bigger items too in going in this direction was, you know, AI. I think that was really one of those items that AI in the Oracle Health environment is really, in my opinion, built directly into more of a clinical workflow. And the Oracle Health Clinical AI agent really helps draft documentation and really, again, as you know, it supports on decision making in the background, which again reduces that documentation burden and really gives providers more time with patients. This was one of the bigger factors for us in really addressing the clinician burnout. We incorporated what we call AI charge assist, which basically allows and helps the actual provider when documentation is fully completed in selecting or providing a specific CPT code that would be beneficial for that specific patient itself. So theoretically, there could be some more enhancements of reimbursement back to the organization itself, maybe pass through medical necessity. So there could be a lot more passes versus fail outs with that specific process in place. And again, in the end, too, John, as you know, providers should never be put into the realm of being actual billers or being coders. I mean, we have to put them what they're designated to do, and that's provide and enhance better patient care for the patients that we basically serve in our area. So utilizing that type of technology within the AI charge assist, within the ambient AI modules to really improve on better documentation process for the providers. I mean, we've been in this age of the EHR within healthcare. You see a specific provider behind an actual workstation, not having that one-on-one with that patient face to face creates issues. In the end, we have to let providers be providers, and that's such a critical thing because we can address solutions that could potentially help and improve these specific outcomes moving forward. And again, we wanted a system really built for the future. I think that was really one of the critical components was we wanted to see what would be a long-term partner, what would be a long-term technology investment that was really designated into the future growth of healthcare. And again,
Mhm.
Oracle's cloud-based design and long-term focus on data, AI, and interoperability really gave us a foundation that we could keep evolving without constant major overhauls. We also incorporated a process called seamless exchange, within the overall project initiative, which allows us and gives us that ability to have that complete view of the actual patient, even if the patient leaves from our facility and goes to a higher level of care. Even if that specific health system has a different EHR system, we still have the ability of extracting that patient that's basically going to that higher level. So that creates a lot of interoperability moving forward. And another thing too is we wanted to be more of a dedicated standalone facility. We did not want to be tied to an actual health system.
Mm.
Unfortunately, we can't just go out and just purchase a Epic instance, for example. So again, their overall Epic Community Connect initiative, where you're connecting to an actual health system, was a specific model that was presented. There was another solution that we also looked at on the Epic standpoint of things too, was, with other groups to connect into their actual backbone. You wouldn't be tied to an actual health system itself. But the thing is independency was such an important thing. We wanted to make sure that the specific selection that we really looked at going with really fit, fit under the overall culture of what we are as an organization. We want to be independent. We want to be agnostic. We want to basically make sure we're being innovative. We want to continue to build on what we've done as a very strong, smaller facility itself,
Mhm.
especially on a national level. And this was really one of those specific reasons of going in this direction moving forward.
That's awesome. It's interesting you mentioned AI as such an important element in your decision making. How was that? I mean, I would kind of wish I could go in your meeting. So take us into the meeting where you have the clinical, you have the rev cycle, you have the IT people. Who was driving that AI kind of decision? Was it more IT or was it the clinical people who are like, we need the AI because we're suffering? Or like, yeah, take us in that decision making.
John, it was really a mix of everything,
Yeah.
of all specific groups that had opinions in regards to this. Because again, this was a multidisciplinary project initiative that we were looking at executing for this organization. So we needed input from our providers, from our clinicians, from our employees, from some of our overall patient advocates as well, on what we're currently doing. Just giving those specific initiatives was really important. And you figure we're in a smaller region too, so we're doing a lot more with less. So utilizing tools and technologies to really improve on better automation, better outcomes is such an important thing moving forward. And if we can use this technology in doing that and successfully doing that, in reducing documentation, in improving specific reimbursement with possibly the enhancements of better CPT codes, reducing issues with medical necessity, incorporating better ways for the providers that they could utilize a specific tool like AI to create better outcomes for a specific patient that is under their care. Those are such critical elements moving forward. And again, though, too, John, this wasn't really about picking the biggest name. This was really about choosing the partner and platform that really supported our clinicians and our overall future direction as well.
Awesome. So talk to us about the timeline. Where are you at in the implementation of Oracle? What does that look like? And what are some things you're doing to kind of make sure that it's a success? And we know, there's not like a one-time EHR go live event. It's an iterative process, but tell us where you're at and where you're headed, timeline wise.
Yeah, absolutely, John. So this is a 12-month implementation. This is a one-year project. There's a lot of moving parts in place. We're currently targeting to go live in late 2026. So basically just around the corner. This really gives us the time to do this the right way, which is so critical. Right now we're really focused on governance. We're focused on workflow design and really deep clinical engagement, which is extremely critical. We've also established a clear decision-making structure. We really identified all of our super users across departments and really investing heavily in change management and training, which is an extreme critical element for success. And again, technology is only part of this overall EHR project. The real work is really preparing the actual people and aligning the workflows and building confidence within our overall team. If we do that well, go live becomes a transition point, not an actual disruption moving forward, which is definitely my overall critical plan there.
Yeah, that makes a lot of sense. You're taking me back. When I first started writing about EMR and EHR implementations, I wrote an article about a 3-day implementation I did. And the CIO came on and said, "You lost me at 3-day implementation." Of course, it was for an ambulatory clinic with a brand new clinic. So totally, but I'm sure you feel the same way you're like, no, 12 months is fast for a hospital with legacy systems and everything else.
12 months is super, it's still super fast too,
Yeah.
even though it sounds like a very long time. But there is, again, so many parts that are basically moving, from clinical workflow, from governance to archive solutions. We can't forget about all the historical data that we've consumed for multiple years
Yeah.
moving forward. So there's a lot of strategy in place. And a 3-day implementation, sign me up for that, man. I would love that. Let's
Yeah,
just
well,
do it and move forward.
It was a unique situation. One doc, solo practice, brand new. And he said, "Hey, John, I have 3 days to implement this, or otherwise I'm going to start on paper and have to convert later." And I said, "Well, let's do it." We strapped it in. He
I
had been
love it.
selecting for a little bit before that, but yeah, it was a forced situation, very different than yours. But anyway, so it's funny to think back. You
That's
know,
amazing.
moving outside of the EHR, what other areas are you kind of working on or kind of keeping your eye on, and why are you interested in them or working on them?
You know what, John, as you know me personally as well. I always speak around cybersecurity. Cybersecurity
Yeah,
continues to remain
that's
a
your
top
love.
priority. That is such a critical element. Going from, if you look at the healthcare industry itself, we went from the top 10 to the top one most attacked industries out there. It's such a critical element of making sure that we as an organization continue to incorporate technology and cybersecurity as an actual core element to everything that we do strategy wise. It's such an important thing because protecting patient data and really ensuring system resiliency is honestly the foundation of what we do with everything moving forward. And we're also expanding, the use of AI, especially within our radiology
Mm,
practice, where it
nice.
supports early detection and fast turnaround times for our radiologists, which directly affect patient care outcomes. And the specific AI algorithms that we've incorporated into our radiology practice have been life-saving initiatives, which again, this is where we can show success and we can show good outcomes with the utilization of artificial intelligence is to produce those better enhancements and better patient care moving forward. Because at the end of the day, we work in healthcare, and the most important thing that we do is taking care of people, enhancing lives, giving them an opportunity to expand that, to improve on their overall outcomes. That is such a critical thing. And I think as being an actual technologist, it's such an important time for us too to incorporate these type of tools in place, show the in that innovation that we could basically do that. I mean, we've always tried to, outdo the barriers when, hey, this is just a small organization. What would they know about innovation or digital transformation? It was like we were showing what we were able to do. We were accomplishing a lot of these initiatives. We were bringing strong startups in place. We were creating all of these successful outcomes, these white papers that showed the enhancements of better patient care initiatives, the use of artificial intelligence, the improvements of digitalization and cybersecurity. I mean, it's been such a phenomenal thing to see. And getting all of these accolades weren't just to get an accolade. It was just to show that we can compete just as good as these larger health systems moving forward. And honestly, probably even better because we don't have all of that mix of different governance to make decisions moving forward.
That's interesting you say that. Like I think the one thing I love about critical access hospitals like yours is that you're not just treating the patient, you're treating your neighbor, your friend, and these are people in your community that you
A
probably
hundred
know.
percent.
Is there something about critical access hospital IT efforts that maybe others don't appreciate that is either challenging or an opportunity, as you kind of described too? There is unique opportunities in personalization that you can probably do that maybe the large health system can't.
One thing, John, is we have to be super creative.
Hmm.
That's basically the bottom line in regards to what we do. We have to be very creative. We have to show a strong reason of why we are investing in this technology moving forward. That is
Hmm.
such an important aspect there too. And it's a critical thing. And I've always stated this too, because we always talk about rural health, and we see how metro and urban, how sometimes their overall healthcare outcomes could be a lot different. And unfortunately, the data shows that, individuals living in those, metro areas, since they have access to more of these higher levels of care, their overall life expectancy lives longer than people in rural America because of the lack of services. The thing is, though, John, too, is our zip code should never determine our healthcare outcomes,
Hmm.
period. And that is such a critical thing that I've always engraved into everything I do is What can we bring to really enhance better patient care outcomes? Better innovation that's going to improve on the way that our providers are accessing and providing care for the actual patients, how our patients are utilizing the tools that we have in place to take advantage of their care more to improve their overall outcomes. I've always stated this too, and I think I stated this in one of your podcasts, is that as a technology leader, if we do not continue to build strong asynchronous tools that benefit our patients both inside and outside of our organization, we're not going to be successful moving forward. So that is such a critical thing. And that's what I've always stated too, is that your zip code should never determine your healthcare outcomes. Creating a specific healthcare organization that's just as good as some of these larger facilities moving forward is really the goal.
Yeah, that's a good goal. Well, as we wrap up this episode, we always like to end with some career discussion, career advice. What would you say is maybe the best piece of advice you've been given in your career?
So it's kind of funny. So a mentor once told me, technology should never be the star of the show. The
Mm,
patient should be. And that's basically the bottom line.
mm,
The patient should be the number one thing that we do. Patient care is number one. And you've quoted me on this too. I've always stated that, I don't care what position you do in healthcare. We all have a new CEO, and that CEO is basically the patient. And that is
mm,
such a critical element moving forward because we have to focus on that. We have to develop the initiatives that are basically needed for these individuals to access the tools that are very beneficial, very quick, very easy. I can get my results. I could validate it. I could share it with other specific facilities. Our providers having the ability of, seamless exchange of information, the enhancements, better clinical care documentation, better ways of documentation, reducing burnouts, bringing in all this innovation. That's really important. But again, technology should not be the star of the show. The patient should be. And that really stayed with me again. It really reminded me that every system and every upgrade and every security control exists for one reason. And that's basically to support the patient and the care team that we have within this organization itself.
love that. What a way to wrap up. The patient's the star, not the technology. That's a good message for everyone. So thanks so much, Michael, for taking time to join us on this episode of the CIO podcast. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Michael.
Thank you, John.